Good afternoon, everyone. I'd like to call to order this August meeting of the Jail Oversight Board. Joining us remotely, in addition to who you see in front of us, is Judge Brennan, Jonathan King, and Executive Director Lazarus. And if I'm missing anyone who's on Zoom who I didn't say from the board, please speak now. If not, that is our board, and we'll rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. First, just a housekeeping announcement. We had an executive session yesterday to discuss matters with regard to personnel and matters of public safety. The next item for today is public comment. And as always, we have 2 rounds of public comment. The first round is on matters that are specifically on the agenda. And there will be one at the end of the meeting for anything related to the Jail Oversight Board. So if there's anyone from the public who wishes to address the board, please do so now. Limit your comments to 3 minutes or less, and please give your name and address. Is there anyone from the public? Hearing none. Next item for today is an approval of the July minutes. Is there a motion to approve the minutes?
Approve.
Thank you, Controller Phillips. Is there a second?
Second.
Thank you. Motion is second. I'm not sure who that second was from.
Mr. King.
That was Mr. King. Okay, thank you. Any comments on the minutes before we vote? Hearing none, all in favor?
Aye.
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 Any opposed? The ayes have it. Next item for today is an approval of the reports from July. Is there a motion to approve?
I'll make a motion.
Thank you, Brian. Is there a second?
I'll second.
Thank you, Controller. Motion and second. Any questions or comments on the reports? Hearing none, all in favor?
Aye.
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 Any opposed? The ayes have it. All right, the next item for today, I will turn to our Warden Williams to make an introduction.
Good evening, members of the Jail Oversight Board and any community members that might be listening today. I would like to welcome and introduce Deputy Warden Hector Portillo, who will have a primary focus of overseeing security and training operations in our facility. Deputy Portillo has been with us for 2 exciting and very busy days. He has extensive experience from years of working within facilities in New Mexico, Mississippi, and Texas. We are very fortunate that he has been able to join our team and work alongside our interim Deputy Warden, Michelle Miller, as she's finishing out her contract. So I've asked him to come today so that he could meet members of the board and, if he's interested, speak a few words.
Thank you, Warden.
Thank you, Warden. Good evening. Good afternoon. My name is Hector Portillo, Deputy Warden of Security and Training for the Warden, and I am here at the pleasure of the County of Delaware. I am very much looking forward to working for the facility and for the county. Very exciting 2 days, a lot of good opportunities and incredible staff, a great team that very supportive and very committed to the goals that we have for our facility. So thank you so much for this opportunity.
Mr. Portillo, can you just speak a little bit about your background and what you did during your career before coming to Delco?
Definitely, yes, sir. I started off before corrections in education in the private field, teaching English as a second language and also teaching ethics and virtue for a private Catholic school and abroad in Mexico. It brought me to corrections in New Mexico because of the rehabilitative efforts that the facility was providing at the time, and it really called to me. So I started off as a correctional officer, as a cadet, and grew through the ranks there. did a lot of lateral moves, taking on subject matter expertise in emergency preparedness, incident command with the National Institute of Corrections and FEMA. I am a certified master instructor in incident command system in corrections, incident command system for corrections, actually, to be specific. I'm also a subject matter expert in leadership development and employee development as it is, something that I am very near and dear to my heart is the development of employees. I believe in the development of our employees, the people we serve. My other background is just working in corrections as it is, security and just training. I have about over 15 years specifically in corrections, 20 to 25 years specifically in the role of a leadership in one capacity or other, whether it be safety, security, or that of a teaching capacity.
Well, we are grateful to have you on the team. It's obviously a very important role within the jail, and glad we've found someone to capably fill that role.
Thank you, sir. On the contrary, I'm very excited to be here.
Welcome.
Any
Thank you.
other questions or comments from board members?
Again, thank you.
Sir.
So I'm going to have assistance before, even though we've been limited today with technology, I won't give up on visual aids. Go ahead. Typically, we start with our coronavirus update, and though I was hopeful we might be able to cease these updates, Delaware County did advance to the medium transmission rate. So last month we were in the low transmission rate. Though masks are still optional, they are worn by many within the facility, and we are still actively working on increasing our vaccination population within the facility. So in the month of July, we tested 98 incarcerated persons. 6 out of those 98 were diagnosed as positive for COVID-19. We have 3 positive cases currently within the population. They are all reported as being asymptomatic at present. So they're not really experiencing any of the concerning symptoms, but they are being monitored and treated by healthcare staff. We did complete an on-site vaccination clinic. Unfortunately, only 12 incarcerated persons elected to receive vaccinations. And some of the feedback that the population provided was a request for additional education on the benefits of being vaccinated. Because so many people who are vaccinated have contracted the virus, the majority of the population says, what's the point? So we are working to get some more information out and see whether or not we can continue those efforts. Right now, we have a current population of 37% vaccinated within the institution. In July, we had 3 staff test positive, but as you can see, since the community is trending upwards, we too are as well within our staff. And we currently have 5 that are within the recovery process from COVID-19.
Warden, just to pause there, can you speak a little bit to what actions the jail is taking in the ongoing sort of situation that we're in to ensure that we don't have a massive outbreak?
Absolutely. So when we have individuals who are diagnosed as positive, we are looking at where they might have been housed. And then healthcare staff is able to evaluate whether or not there's any increased risk within those populations. We're strongly encouraging anybody who is new, coming as a new commitment from the community, especially since those rates have increased, to be screened for symptoms and determine whether or not there are any risk factors. We're also, of course, encouraging mask wearing within the facility. Should we see our numbers climb any higher, I think that we can take some additional measures. We're still doing the cohorting within our intake housing units as well to make sure that we have ample time to screen individuals. And then, though most of the community does go back to work at the 5-day mark, in congregate settings, that's not the recommendation. So if a staff person is diagnosed as positive, or if an incarcerated person is diagnosed as positive, we're still doing the 10-day isolation period. It could be longer if the symptom expression requires that. So any hospitalization requires 20 days of isolation status. So we are still abiding by the recommendations, and that's how we're working to get through this time period still. We've been hesitant to stop visits. We've not yet hit the high transmission rate, but if we were to reach that within Delaware County, we would be ceasing visits coming into the building and reducing movement again within programs. But right now, we would like to get people out of their cells and able to connect with their family. So we are monitoring the situation closely.
Thank you, Ward.
Our current population is 1,332 incarcerated persons, which is an increase of 12 from last month's meeting. Weekender program remains suspended under administrative order. You can see that our total commitments within the month of July was 590. In June, it was 580. Total discharges was 553, and in June, it was 563. So we are releasing less and bringing in more, which has driven our population up. Recreation was completed on every housing unit or block, every shift in the month of July, with few exceptions. So we had some security issues that you can see on the calendar dates. There were 4 total shifts in which recreation wasn't provided to the entire population. So the majority did receive it, with the exception of the 31st on second shift. But Unit 8 was impacted twice, and 5 Bravo was impacted once. We have been working very hard to increase recreation opportunities, and with the assistance of our fire and safety manager, as well as many other staff, such as our sergeants, lieutenants, and hardworking officers, we've been doing extensive cleaning opportunities to try to get the facility to be more habitable and safe within the environment. And when we've done that and seen demonstrated progress, or a large effort that's been done by the population, that has been rewarded by the entire housing unit coming out for recreation at the same time, which has definitely motivated persons. They don't want to be within their cells. So the population and staff are definitely working together to increase all of those out of cell opportunities. Additionally, this week, we started to increase availability of tablets that I believe Deputy Warden Falley may speak on in a little bit. You can see major incidences. We had significant power issues on Unit 8. That was the, attributing to the lack of recreation. And we have been battling, I think as many have been, with the heat waves that have been hitting our area. Air conditioning units are past their life. We've discussed that, and the facility's presentation, I think, really detailed how we have gone well beyond the life of many of these units and are waiting for parts. So though they are functioning, they are not functioning at full capacity. So we've been coming up with creative solutions, again, increasing the time out of cells so that there can be airflow, getting ice to units, working with fans, things like that. In the month of July, we had 18 incidences of serious contraband that were identified during our shakedowns or cell searches or pat searches. So this was why I wanted visuals, because I am so proud of the continued cadet basic training academy classes and the graduation of new officers. So in the top right hand corner, you can see class 622 that graduated on July 15th. And we have 9 officers that will be graduating on Friday. That will be our 11th class. At the end of the month, we anticipate 4 new officers. And then we did just start another training group, and that will yield us 11 new officers in the beginning of September. We also had a number of our civilian positions, our treatment and or maintenance crew, case management that completed training as well. So we celebrated them during this last graduation period. This group was pretty incredible. The officers and the case management, substance use staff, and maintenance tech all really bonded and developed strong relationships throughout their training period. And I think the multidisciplinary engagement was really important so that everybody understands the different missions that we all have within the institution and can better work to accomplish the goals at the end of the day. We have another class of cadets and support staff that will begin their training at the end of this month. I believe right now we're anticipating 12 officers to start within that training class, and we still have remaining classes scheduled to begin September 26th, October 24th, and November 28th. And that will bring us through the closure of this year academy classes. I believe that the final one graduates on January 3rd of next year. We are, of course, seeking additional employees. So I did put, some screenshots for anybody who might be listening in the community and seeing this or know somebody who would like to join our team within the facility and county employment. So we do have correctional officers with the $2,000 sign-on bonus. We are seeking maintenance technicians primarily for our second shift availability. And though not a county position, WellPath, we've added their job links to the website as well, so that anybody who's interested in joining the team is able to find that. And that does include mental health professionals, registered nurses, and somebody specific to do medication-assisted treatment on the weekends. So we would be seeking either an LPN or RN, and you can go again to the county website just by Googling Delaware County Careers to find those job postings. It's very exciting that we've been able to fill the majority of the vacant positions and are hoping to be able to round out with correctional officers and maintenance technicians very soon. So we talked a bit about Employee of the Month and recognition last month. So we have been accepting nominations, and typically we award 2 employees, but this month I just couldn't limit it to 2. There were too many people that had nominated the 3 that were selected and really spoken very highly about their efforts. So in the month of August, we decided that we were going to acknowledge 3. And that's our Fire and Safety Manager, Dan Dewar, Nurse Edie, Correctional Officer Eugene Jackson. And you can see the previous month's Employees of the Month, and that we do allow them to have a designated parking spot. They gain a certificate and recognition amongst the staff, but it's really important to acknowledge and recognize how hard these employees have worked within the institution, really going above and beyond, not just in their day-to-day duties, but support for their peers as well. We've talked a little bit about behavioral health services, and last month the board did support having a psychological expert that will come on site. So Dr. Metzner is confirmed and will provide a comprehensive facility review this month. So he'll be here next week. And as we discussed, I'll be reaching out to members of the board so that we can have a meeting, either a pre-briefing or a debriefing, and discuss items of concern with Dr. Metzner while he's with us. And I've said it in the past, but it's always worth saying again, correctional facilities were not constructed to be inpatient mental health institutions, substance use treatment facilities, skilled nursing facilities, or hospitals. Despite that, correctional agencies throughout the nation are working to find creative solutions to the physical barriers of the correctional environment and need for increased services to be provided to the population. And we are contracted with WellPath, and we're currently working to ensure that we can increase the capacity of structured services to increase behavioral health outcomes. And we've been doing that. One of the demonstrations is within our medications for opioid use disorder program and commitment to buprenorphine, which again will be discussed within Deputy Falley's presentation. But we're going to be looking at opportunities within increased structured and unstructured mental health services, or therapeutic education opportunities for the population, both on an individual and group basis. And we find that we've reached a point within transition that we've stabilized enough to a degree, though we're certainly not where we want to be, where we can look towards expansion of some of these efforts and build upon the foundation that currently exists within the institution to try to meet the current need of the population. And as we discussed in executive session, this is extremely important. You know, though this wasn't what correctional facilities were built to do, with decreasing access in the community and an increased need based on stressors in life in general and what the pandemic has had on all of us, it's important that we recognize that this is where we are, this is what is needed, and find a way to fulfill that. We've also been contracted with Aramark and wanted to discuss within the public setting that we've been working with our partners to make sure that we can provide the services, comply with the contract, and meet the needs and requests of the populations. So we've been very challenged within our commissary department as well as dietary to get the available items delivered timely. So supply issues have been impacting the menu options for both of those areas. And we wanted to be able to ensure that we spoke about that publicly. The supply and demand challenges has impacted the level of credits that need to be applied to incarcerated persons' accounts. And to combat that and to ensure that we are providing those credits timely so that we do not see increased delays for the incarcerated person where they may not be able to order for weeks at a time, Aramark has decided to hire a manager who is anticipated to start next week, specifically focusing on the credit application. So anytime an item is not available that they were charged for within commissary, they should be credited that money back as soon as possible. So we appreciate the commitment from Aramark to work through that challenge with us, to acknowledge that that is a problem that needs addressed. We are also working to review and increase the commissary menu, see if there are different items that can be made available that there are not supply chain issues with that might be able to fill in some of those gaps. Additionally, we've been working with the dietary organization and department to implement a seasonal menu so that we might increase the variety of the diets that are served. And Aramark has also agreed to a special meal once a month for the population. So last Thursday, we were able to serve hamburgers and French fries. That was a specific request from the incarcerated population to have something different every once in a while. And that was something that Aramark thought was a reasonable request and that they would be able to provide for us, and did so very quickly based on our request. So wanted to be able to speak about that within this setting. And I had no further presentation unless there are questions or comments. Otherwise, I will invite Deputy Falley to the podium so he can report on his progress. Okay.
I was wondering, are there people that don't have any access to commissary just because of their means or their lack of family support? I'm just curious how that, what the magnitude of that number might be, and if it has an effect on the population and what you have to deal with.
There are definitely individuals who we would define as indigent, so they do not have funds that are applied to their account. And there are different accommodations that are made for those individuals, but they would not be able to order from commissary. They are entitled to a free phone call. The entire population actually still gets a free call at least once a week within the institution. We are able to provide hygiene products and things like that. But other than that, those that do not have money on their account cannot make any purchases.
Thank you.
You're welcome.
Any other questions or comments from board members? I just wanted to comment with regard to WellPath and Aramark. You know, I think we're all aware of the challenges with regard to supply chain and hiring that's out there. We ourselves face them. And I certainly hope that we have a long and mutually valuable relationship with both of our partners there. But I think I speak for this entire board when I say that, we will be ensuring that we get compliance with our contracts. So we'll be, and I know that you share that, Warden. We want to make sure that those vital services they provide are done in compliance with the contract.
Absolutely. All
Anything
right.
else from board members? All right, Warden.
Thank you. Deputy Fally?
Thank you, Warden. Good afternoon, Chair Madden and General Oversight Board. It's a hot Tuesday today. A couple of updates. I didn't do a big presentation because my presentation comes quarterly. As Warden Williams stated, we are focusing on treatment at George W. Hill. I remember, if you guys remember, last month we started our Verify continuous Suboxone program. In the month of July, we had 5, and guess how much we have as of today? 22. Huge increase. So there's a need. There's a huge need for the services, and thank you, WellPath, for providing those services for George W. Hill. Couple of updates. This week, we started our distribution of 1-to-1 tablets. Every incarcerated person this week will have 1-to-1 and have access to all the features in the tablets, some free features and some features with fee. Yesterday and today, we targeted units 7, 6, 4, and 5. Tomorrow and Friday, we'll do 8, 9, 10, SMU A and B, medical. Last month and every Thursday of each month, we're going to have a block rec meeting in which every single department within George W. Hill will be available and talk to the block rec and answer any type of issue that we having inside the housing unit. The first one went very, very well. We learned a lot about the incarcerated person. All of the deputy wardens, we usually go once a week or more than once a week in the housing facility just to engage with the incarcerated person. Last month, we hired a mental health professional, and this announcement is for the court. Starting next week, we're going to start groups, anger management groups. It's an 8-session group, and it will happen on Monday from 9:15 to 10:45, and Fridays from 9:15 to 10:45, and for the female on Mondays in the afternoon. We're also going to do a behavior modification, which is our sex offender group. And our behavior modification is a 20-week program, twice a week for an hour and a half. So any judges who feels that a incarcerated person want to serve the service, they're free to do it. Our recidivist rate for the month of August is 64%. I'm not going to go too much with the report that I sent you guys, but I'm just going to highlight some main case. We had 3 individuals that graduated with a DDG for the month of July. We enrolled 19 individuals for PrEP, which is our substance use services. We had no death, which is great. However, our chaplain had to deliver 6 incarcerated person some bad news according to the family member who passed away. Our referral process for outpatient services is 6 to 9. Any questions?
Questions to the board? All right. Thank you.
Thank you.
Any other reports from? Okay. Thank you, Warden. Subcommittee reports. Hearing none. I think we're at public comment. Is there any other public comments for today? Well, after a very lengthy last month's meeting, I think we're setting a record for the shortest Jail Oversight Board meeting. Any board member comments?
Mr. Chair, if I may,
Yes, Mr. Lazarus.
I just want to bring up some things that Warden did not, and many of them are to her credit and her staff. First of all, I'm glad and pleased to meet our new deputy for security. While I've spoken to him over the phone, I've yet to get a chance to meet with him face to face. I'm sure, as everyone is, there'll be a great addition to the team. Look forward to getting a chance to say hello when I get back next week. 2 weeks ago, through the efforts of Warden Williams and Mike Young, who is working on wellness activities for the staff at Hill, we met with out at Miramont, the mainline health facility, to address assistance and mental health programs for our corrections officers and first responders. Vice Chair and Controller Phillips joined us, and there are some excellent opportunities for us to expand support of our staff who deal with very stressful situations. We also spoke in taking the facilities condition needs assessment and moving it into a master plan for the facility, not just bricks and mortar, but also programs, which will help us with being at the leading edge of looking for grants, foundation partnerships, and other opportunities to bring leading practices and to really help form practices, best practices out of George W. Hill. Finally, Warden Williams, Deputy Warden Mastrati, and I went through a preliminary look at their budget for next year, and we will bring that back to the board next meeting with time to comment and make recommendations before the budget management director turns that over to me at the beginning of October and before it's submitted to council for review at the beginning of November. So those are some really positive changes that have occurred. It does not in any way mitigate the challenges that we face, but it does show that in a very difficult market, we've recruited excellent leadership for George W. Hill, and we're continuing to push forward to make us the thought and practice leaders in the area. So thank you very much.
Thank you, Howard. Yeah, and I'd like to just dovetail on that. I think we've had a lot of discussion over the last couple of years, obviously around management, but what hasn't gotten as much publicity, but I think is equally important, is the challenges from an infrastructure perspective. And so as Executive Director Lazarus alluded to, and as we heard in the report, we do continue to have problems with an aged infrastructure that has not been invested in and maintained over the last decades. And whether it's AC units that fail and we have to put in temporary fixes, or it's the kitchen, or it's laundry services, we got a lot that, doesn't happen overnight, but as the executive director said, we now have a facility needs assessment that's been completed. We have a very capable facilities director who is launching projects to, bring this facility up to snuff. So I think the public, the employee population, the incarcerated population will be seeing in the coming months a real change addressing a lot of these challenges that create day-to-day problems for all involved there.
I'd just like to comment too that, it seems like we've been doing this for a long time, but it's really only been a couple months that we've been under our control. I just want to remark to the board that the interactions between the people in my office and the jail, I just want to commend them, everybody, for all the work they're putting in to keep things running at the back of the house, which has always been a challenge, and it's new, hundreds of people to add. And Mr. Brogan was in our office today with Deputy Magaro, and they're working through things. Happen in payroll systems. There's things that are not anticipated. Everything doesn't fit like a glove, and we've got really capable people working through issues to keep things rolling. And if there's something that's wrong, we'll fix it, and then we learn, and we'll put that behind us. So I anticipate we're all still going to have those things going forward, but I really feel optimistic that we're knocking them out as we go, and as soon as we catch our breath, we can tackle the next thing. So I just want to commend Deputy Williams and her deputies, and Deputy Mastrati, and we're in pretty much constant communication with my office. So bear with us, and I do appreciate everybody's camaraderie in doing the work.
Thank you, Controller Phillips. And I do appreciate the, infinite amount of effort that goes on in the background between your office and personnel and the offices respectively at George W. Hill. Anything else from board members for this afternoon? Hearing none, I would entertain a motion to adjourn.
I make a motion for adjournment.
Second.
Motion is second. All in favor?
Aye.
Aye.
Any
Aye.
opposed? The ayes have it, and we are adjourned. Thank you, everyone.
Thank you.